Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're really happy to have you all here with us this morning for our first installment of Webinar Wednesdays for 2025. My name is Sunny Lawless, and I'm the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'm going to be your host for this morning. Presenting for us today is going to be Danae Brown, who is one of our Community Outreach Specialists in Mississippi, and Ms. Jonetta Red, who is our Complex Interaction Specialist. Today, we're going to talk about getting to know your SMP. So you're going to learn all about the Senior Medicare Patrol program and what we do. During the presentation, you're welcome to type any questions that you have into the chat, but we are going to hold those until the end of the presentation when we open things up for Q&A. Before we get started, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. Now, before we get started today, we do have a quick polling question for everyone. Our polling question today is, before today, have you ever attended an SMP presentation? And that's going to be a yes or no answer. And let me launch that poll really quickly. Have you ever attended an SMP presentation? It looks like my poll left off the word presentation. So please answer yes or no, and we'll give everyone just a few moments to answer. Okay, I'm gonna give it another 5 seconds and we'll close the poll. All right, so right now it looks like a little over 60% of you, or close to 70% of you, have attended an SMP presentation, and then almost 40% of you have not. So I'm gonna turn things over to Danae, who is gonna get us started with today's presentation on who we are and what we do.
Good morning, everybody. I am Danae in the state of Mississippi, and so we are going to talk about what SMPs do. So we work in three main areas. The first area is that we conduct outreach and education. SMPs give presentation to groups. We exhibit at events, and we work on one-on-one with Medicare beneficiaries. We provide education opportunities for seniors at places like senior centers and independent living facilities. We're also available to speak to churches and other small groups. Our presentations typically last 15 to 20 minutes and then allow some question and answer time afterwards. We provide educational materials and giveaways to the attendees. We also schedule virtual presentations for our groups that may want that. The second area is that we receive Medicare beneficiary complaints. So when Medicare beneficiaries, caregivers, and family members bring their complaints to SMP, the SMP makes a determination about whether or not fraud, errors, or abuse is suspected. When fraud or abuse is suspected, they make referrals to the appropriate state and federal agencies for further investigations. Next slide, please. We also engage volunteers. So protecting older persons' health, finances, and medical identity while saving precious Medicare dollars is a cause that attracts civic-minded Americans. Our volunteers receive training to give presentations on Medicare fraud and scams, and they attend community events and help spread awareness of the SMP program. And they also participate in monthly webinars and other activities. Next slide, please. So let's meet the team. We'll start with Georgia. Pictured, you'll see Nathan and Brenda and Shay. Next slide. We also have Jose and Ravine in our Georgia area. Next slide. In Louisiana, we've got Sandra and Yolandra. Next slide, please. In Mississippi, you'll see your very own Danae, that's me, Danielle and Jeanette. Next slide. And Vermont, we've got Jean and Justin. Next slide, please. So, of course, our program would not be successful without our volunteers. Their dedication and their support is key to our program. Next slide. So let's talk numbers. The SMP program model is one of prevention. SMPs educate Medicare beneficiaries to scrutinize their medical statements and bills and subsequently reduce fraud and errors. Though Medicare beneficiaries have several avenues that they can take to report fraud, such as the Office of Inspector General hotline, or they can also use, 1-800-Medicare. Some Medicare beneficiaries choose to report fraud to the SMPs. In these cases, SMPs refer the complaint to the appropriate entity. In 2023, the SMP projects had a total of 5,532 active team members who conducted 22,356 group outreach and education events, reaching a little over 1.2 million people. In addition, the projects had 270,348 individual interactions with or on behalf of Medicare beneficiaries. This SMP projects reported $111,277,683 in expected Medicare recoveries. Cost avoidance totaled $34,306, while savings to beneficiaries and others totaled $43,554 for all SMP projects. This can be referenced on the OIG website. Next slide, please. So guys, did you know that Medicare loses $60 to $90 billion every year due to fraud, errors, and abuse? And yes, I said billions with a B. Next slide. So let's talk a little bit about fraud and abuse and the difference between the two. Next slide. So what is fraud? The main difference between Medicare fraud and abuse is the intent. Was the improper behavior intentional and conducted knowingly? Only the authorities will be able to make a final determination, not the SMPs. It is still important to know the differences in the definitions of fraud and abuse. Both terms are commonly used. The actions authorities will take will depend upon whether they suspect abuse or whether they suspect fraud. Fraud assumes criminal intent. Medicare fraud is defined as knowingly and willfully executing or attempting to execute a scheme or ploy to defraud the Medicare program or obtaining information by means of false pretenses, deception, or misrepresentation in order to receive inappropriate payment from Medicare programs. The Centers for Medicare and Medicaid Services further defines fraud as the intentional deception or misrepresentation of the individual that the individual knows to be false or does not believe to be true, and is made knowingly that the deception could result in some unauthorized benefit to himself, herself, or some other person. Next slide. So let's talk about abuse now. Medicare abuse involves payment for items or services when there is no legal entitlement to that payment, and the provider has not knowingly and intentionally misrepresented the facts to obtain that payment. Medicare abuse is further defined as incidents or practices by providers that are inconsistent with accepting sound medical, business, or fiscal practices. These practices may directly or indirectly result in unnecessary costs to the program, improper payment, or payment for services that fail to meet professionally recognized standards of care that are medically unnecessary. CMS includes this definition by billing Medicare for services that are not covered or not correctly coded. Next slide. So now that you know the differences between fraud and abuse, let's take a moment to look at the common examples of fraud. One would be billing for services or supplies that were not provided. Another would be providing unsolicited supplies to beneficiaries. Number three would be misrepresenting a diagnosis, a Medicare beneficiary's identity, or the service provided or other facts just to justify payment. And also prescribing or providing excessive or unnecessary tests and services. Next slide, please. Other examples would be offering or receiving kickbacks in exchange for using a person's Medicare number. And lastly, requesting Medicare numbers at an educational presentation or an unsolicited call. Basically, just don't give that information to anybody if you randomly go to an educational presentation, or especially if somebody calls you over the phone, they have no reason to get your number. Next slide. You may be thinking, how could all of this affect Medicare beneficiaries? So here's the breakdown. One, the medical identity theft is a big thing. Medical identity theft occurs when a Medicare beneficiary's number is misused, either by a provider, a supplier, or someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised, and a beneficiary whose number has been compromised may be affected forever. And this may be by false claims against their Medicare number. Another area would be receiving health care from fraudulent providers. Now, this is going to impact your health, which means the quality of the care may be poor. The intervention may not be medically necessary, or worse, the intervention may be harmful. A Medicare beneficiary may later receive improper treatment from a legitimate provider as a result of inaccurate medical records that contain false diagnoses, records showing treatments that never occurred. Also, it may be misinformation about allergies, which is so dangerous, and incorrect lab results. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needs for Medicare benefits. For example, some services have limits, and Medicare thinks, if they think that those services were already provided, they'll deny the payment. And then we'll talk about personal financial losses. Medicare fraud and errors and abuse can all result in high out-of-pocket cost for Medicare beneficiaries, such as co-payments for healthcare services that were never provided, were excessive, or were medically unnecessary. Beneficiaries may also find themselves stuck with bills for services from providers who should have billed Medicare instead, but they bill the beneficiary for the entire cost. Next slide. So now we'll turn things over to Janetta, who will share the 3 keys to success in preventing fraud, errors, and abuse. Janetta?
Okay, thank you, Danae. Good morning, everyone. The 3 keys. The first key is prevention. Protecting your personal information is the best defense against healthcare fraud and abuse. We always ask our beneficiaries to do a few things, and these are some of the tips that we give them. Share your Medicare number only when necessary, such as at the doctor's office or at the pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask for your Medicare number for any reason. Keep records of all medical visits and procedures that take place and medical equipment that was ordered. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, also known as an MSN, or your Explanation of Benefits, also known as the EOB. Your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive the explanation of benefits after you receive healthcare services. Compare your statement to your personal records and look for the following items: medical appointments you did not attend or were possibly double billed for, medical equipment such as braces, catheters, or diabetic supplies that you did not order or that you did not receive. Next slide. The third and final key is report. If you suspect that you have been a target of fraud, report it. This will help you and others at risk of healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statement, call your healthcare provider or the healthcare plan. If you are not comfortable calling your provider or are not satisfied with their response, call SMP at our 877 hotline number shown on your screen. Next slide. So now, you may be wondering, how can I help and become involved? Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in the month of April for National Volunteer Week. Volunteering for the SMP program is extremely flexible. It's done on an as-needed basis. They determine how often they would like to participate. So if you think volunteering for the SMP program is something you may be interested in, give us a call at our toll-free number, and we can send a volunteer information packet and answer any questions you may have about the process. Next slide, please. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platform, including Facebook for Georgia, Louisiana, Mississippi, and we have a Facebook Spanish page. We also have YouTube and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages are a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next slide, please.
All right, thank you, Johnetta and Danae, for that information and for telling everyone about Senior Medicare Patrol and how we can help Medicare beneficiaries fight fraud, waste, and abuse. Our next presentation coming up in February is going to be about using your Medicare summary notice or explanation of benefits to fight fraud. That is scheduled for Wednesday, February 28th at 10:30 Eastern. 10:30 Central, I'm sorry, 11:30 Eastern, that is wrong. But just be on the lookout. We'll send out the registration information soon so you can register to attend that webinar. All right, so now it's time for our prize drawing. At the end of every Webinar Wednesdays presentation, we do give out a $25 Amazon e-gift card. Everyone who registered to attend prior to 10:15 a.m. this morning has been entered for a chance to win, and you do have to be present to win. So let me pull up the prize wheel. Here we go, and everyone's name has been on there if you registered before 10:15. And let's see, we'll give it a spin and see who our winner is. Let's see, Miss Lisa Duffy. Okay, I do see that she's here this morning. So Miss Lisa, congratulations. I'll be reaching out to get your information so we can get that gift card out to you. All right, let me get back to our slides. There we go. All right, so before we wrap up today's presentations, we do want to open it up to questions. So if you have a question, please feel free to raise your hand. If you look to the right of your screen, you'll see a go-to webinar control panel, and there's a little hand button, kind of what you see on your screen now. And if you click on it, it'll raise your hand and we can unmute your line and you can ask a question if you have one. You can also type anything into the chat. We did have a few questions come through during the presentation today. It was mostly comments though. Glad to be here. Hello, Danae, Mississippi, woohoo. This has been really helpful, and someone said that they received a lot of those scam phone calls last year. So thank you guys for weighing in on the presentation today. I'm not seeing anything else coming through the chat or hands being raised. All right, well, this will conclude our presentation today on getting to know your SMP. You will be receiving an email just thanking you for attending with a copy of our SMP info sheet. There's also going to be a link to a short survey that we would really appreciate if you would take just a few moments to complete, and that just lets the Administration for Community Living know how we did with today's presentation. So we appreciate you joining. We hope to see you all again soon, and take care of yourselves.